Aranesp, a medication commonly prescribed by doctors, is used for the treatment of several conditions. This video will delve into the diverse range of conditions for which Aranesp is used, along with important information on dosage, side effects, and reviews. Aranesp is a medication often used to treat anemia caused by chronic kidney disease, chemotherapy, or certain other conditions. It helps stimulate the production of red blood cells in the body, which can alleviate associated symptoms such as fatigue, weakness, and shortness of breath. In addition to its use in anemia, Aranesp is also prescribed for patients with certain types of cancer to reduce the need for blood transfusions during chemotherapy treatments. Understanding the appropriate dosage of Aranesp is crucial to ensure its effectiveness and minimize any potential side effects. This video will discuss the recommended dosages for different conditions and patient types. Read on to gain a comprehensive understanding of Aranesp, including its benefits, potential side effects, and user reviews. Whether you are a patient seeking information or a healthcare professional looking to expand your knowledge, this video will provide you with valuable insights into the uses and impact of Aranesp. Common conditions treated with Aranesp. Aranesp is primarily used to treat anemia caused by chronic kidney disease, chemotherapy, or certain other conditions. Anemia is a condition characterized by a decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the blood, resulting in reduced oxygen carrying capacity. This can lead to symptoms such as fatigue, weakness, and shortness of breath. In chronic kidney disease, the kidneys are unable to produce enough erythropoietin, a hormone responsible for stimulating the production of red blood cells. Aranesp, which is a synthetic form of erythropoietin, helps stimulate the production of red blood cells, thereby alleviating anemia symptoms in these patients. Aranesp is also prescribed for patients with certain types of cancer, such as non-myeloid malignancies, to reduce the need for blood transfusions during chemotherapy treatments. Chemotherapy can often lead to a decrease in red blood cell count, and Aranesp helps mitigate this side effect by promoting red blood cell production. Dosage and administration of Aranesp. Understanding the appropriate dosage of Aranesp is crucial to ensure its effectiveness and minimize any potential side effects. The dosage of Aranesp varies depending on the specific condition being treated and the patient's individual characteristics. For the treatment of anemia associated with chronic kidney disease, the initial recommended dose of Aranesp is typically 0.75 to 2.25 micrograms per kilogram of body weight, administered once every 2 to 4 weeks. The dosage may be adjusted based on the patient's response and the target hemoglobin level. In cancer patients receiving chemotherapy, the recommended starting dose of Aranesp is usually 2.25 micrograms per kilogram of body weight, administered once every 3 weeks. The dosage may be adjusted based on the patient's response and the target hemoglobin level. It is important to note that Aranesp should be administered under the supervision of a healthcare professional, as they will determine the appropriate dosage and frequency of administration based on individual patient factors. Potential side effects of Aranesp. As with any medication, Aranesp may cause certain side effects. Common side effects of Aranesp include high blood pressure, headache, fever, nausea, vomiting, joint pain, and injection site reactions. These side effects are usually mild and resolve on their own. However, there are some more serious side effects associated with Aranesp that require immediate medical attention. These include severe allergic reactions, blood clots, stroke, heart attack, and worsening of existing cardiovascular conditions. It is important to seek medical help if any of these symptoms occur. It is essential that patients discuss their medical history and any pre-existing conditions, such as heart disease or high blood pressure, with their healthcare provider before starting Aranesp treatment. Close monitoring of blood pressure and hemoglobin levels is typically recommended during treatment. Reviews and experiences of Aranesp users. To gain a better understanding of the impact of Aranesp on patients, it can be helpful to explore reviews and experiences of individuals who have used the medication. Many patients with chronic kidney disease have reported positive experiences with Aranesp, noting improvements in their energy levels, reduced fatigue, and overall improvement in their quality of life. Some patients have also mentioned a decrease in the need for blood transfusions after starting Aranesp treatment. In cancer patients undergoing chemotherapy, Aranesp has been praised for its ability to reduce the need for blood transfusions, which can be a significant benefit in managing treatment-related anemia. However, it is important to note that individual responses to Aranesp may vary, and it is always best to consult with a healthcare professional regarding the potential benefits and risks of treatment. Alternatives to Aranesp for treating similar conditions. While Aranesp is commonly used for the treatment of anemia associated with chronic kidney disease and chemotherapy, there are alternative medications available for similar conditions. For chronic kidney disease-related anemia, another medication called epoetin alpha may be prescribed. Epoetin alpha works in a similar way to Aranesp by stimulating red blood cell production. However, the dosing and administration may differ between the two medications. In some cases, blood transfusions may also be used to manage anemia. However, this is typically reserved for more severe cases or when other treatments have not been effective. It is important to discuss the available treatment options with a healthcare professional to determine the most suitable approach for each individual patient. Important considerations before starting Aranesp treatment. Before starting Aranesp treatment, there are several important considerations to keep in mind. It is crucial to inform the healthcare provider about any pre-existing medical conditions, medications, or allergies, as these may affect the suitability and dosage of Aranesp. Regular monitoring of hemoglobin levels, blood pressure, and other relevant parameters is typically recommended during Aranesp treatment. This helps ensure that the medication is effective and that any potential side effects are identified and managed promptly. Additionally, patients should be aware of the potential risks associated with Aranesp, such as blood clots, stroke, and heart attack. It is important to seek immediate medical attention if any concerning symptoms occur. Frequently asked questions about Aranesp. Can Aranesp be self-administered? Aranesp should be administered under the supervision of a healthcare professional. Self-administration is not recommended unless specifically instructed by the healthcare provider. Can Aranesp be used during pregnancy? Aranesp is classified as a pregnancy Category C medication, which means it may not be safe for use during pregnancy. It is important to discuss the potential risks and benefits with a healthcare professional. Can Aranesp be used in pediatric patients? Aranesp is not approved for use in pediatric patients unless specifically prescribed by a healthcare professional. The dosage and administration may differ from adult patients. How long does it take for Aranesp to start working? The response to Aranesp can vary between individuals. In some cases, an improvement in symptoms may be observed within a few weeks of starting treatment, while in others, it may take longer. Conclusion and final thoughts on Aranesp. Aranesp is a valuable medication used for the treatment of anemia associated with chronic kidney disease, chemotherapy, and certain other conditions. By stimulating red blood cell production, Aranesp helps alleviate symptoms such as fatigue, weakness, and shortness of breath. Understanding the appropriate dosage, potential side effects, and considering alternative treatment options are important steps in ensuring the safe and effective use of Aranesp. Close monitoring and communication with a healthcare professional are crucial throughout the treatment process. While Aranesp has shown positive results for many individuals, it is important to remember that individual responses may vary. Consulting with a healthcare professional is always recommended to determine the best course of treatment for each individual patient.